Let's start off the show then by putting the spotlight on Amaha. It's a mental health startup, and just recently they have raised close to 50 crore rupees in an extended Series A funding round that was led by Fireside Ventures, with an additional portion of angel investors contributing about 15 odd crores. Dr Amit Malik is the founder and CEO of Amaha, now joins in on the show. Good to have you on board. To begin with, let's talk a little bit about what the funding plan is in terms of how you're really going to enhance your mental health services.
Thanks for making the time, Avanne. Basically, we are a large mental health organization with over 250 team members and 150 therapists and psychiatrists, and which pretty much makes us one of the largest mental health organizations in this country. And so, on this journey that we've been on in the last few years, this is the next step in the growth, right? This is basically saying, how do we take this capital and really use it to drive our mission, which is to serve patients and carers and their families and clients and their families with mental illness. So this is the next step in that journey of expanding our provision, both from a geography perspective, from a lifespan perspective, across ages, and from a condition perspective. So really being able to serve more individuals and families and organizations with mental health support. That's what the funds are going to be used for next, actually. The who's participated, Fireside Ventures has led the round. And there's a group of very, very reputed angels and family offices that have come along with us in that journey, that's.
Right, Dr. Malik, I just want to understand how you're looking at the overall spectrum of mental health, wellness, all of these startups in the recent years. There has been a lot more awareness about this. There has been a lot more advocacy by important people. Do you think we still have a long way to go?
I mean, it's been amazing. I mean, I've been working in mental health for almost 24 years now. And the last 5-6 years, and especially the last 3 years since COVID, I've seen this huge shift. See, the need's always been there. India has about 200 million people with mental health difficulties and mental health needs, right? And 50 million of them are children. So, but what we've seen in the last 5 years is that need is translating into more awareness, more willingness to seek support, more openness to get the right advice and right professional advice. And so we've seen this huge uptick in people coming forward, families coming forward, organizations coming forward and seeking support. So I think it's the right time for something like this to really evolve. And we've seen this huge growth, right? We were about a 7-8 people clinical team 2 years ago, and now we are 150 plus clinicians on payroll, which has been this huge increase in demand that's solving it. And so one of the core things we're trying to do is with this money is build capacity, right? So which means that how do we build capacity within professionals, those therapists, psychiatrists, but also within the community, right? With schools, with employers, with insurance companies. How do we build capacity for mental health support across the ecosystem so that huge need can be met in different ways, essentially.
Right. So tell us a little bit about how your business works. Then you have in-person centers. Which cities are those located in, and what kind of digital services are you providing via the app?
So given our focus on being able to solve complex mental health difficulties for individuals and families, we always knew that we'd have to develop an omnichannel model, which means that some people would see us both in clinic and online, along with the range of interventions between those episodes, right? So self-care, consultation in clinic, consultation online with therapists, with psychiatrists, with other mental health professionals, all happening in a seamless journey for the client and the family, right? So right now we have a digital platform which caters to nearly 600 cities now in India, and does that through almost 15 languages. And then we've now opened our offline physical presence in 3 cities, Delhi NCR, Bombay, and Bangalore, all have centers in those 3 cities where people can be seen face to face. And with a commitment to providing lifespan care, we also acquired and partnered with India's leading child mental health organization a couple of years ago. And so now with Children First in Delhi, we can also work with very, very young children with severe mental health difficulties and development difficulties. So now we can serve our youngest client is 9 months old, and our oldest client is in the 90s, right? So we can serve across the lifespan.
Now, despite the fact that your losses have been widening in the year 2023, you've been investing a lot in infrastructure. What is your target or earmark in terms of when you're likely to become profitable, and how How are you looking at really spending at a time when the losses are mounting?
So, I mean, if I just talk about that for a second, we've invested hugely in building our capability on the technology platform, both for the end users, so clients with mental difficulties and their families, but also for our professionals, right? So, how do we build a technology ecosystem that can create seamless access, that can create sort of high value support continuously for the users, and that's what we invested in heavily, but also invested in infrastructure, right? We've opened new clinics in the last year. So both of those have led to obviously some widening losses. The outlook on profitability, we expect to be profitable in the next 15 to 18 months. And so this capital will take us to profitability. And the importance of that is that given how much the need and demand is, it gives us a clear visibility on sustainability and being able to serve our clients and families for the long term, which is what we really want to do here essentially.
And one can't deny the fact that there are a number of startups now in the mental health and wellness space. So how is it that you plan to stand out? What is it that you're going to do to deal with competition?
I mean, we're very early. I mean, everybody's very early. The space is early, right? So there's still a lot of need. As I said, there are 200 million people in India with mental illness, and we need so many more people working in this space. We need so many more stakeholders, so much more capital and investment. So right now, our attitude and approach is all about collaboration, right? We had how to collaborate with different organizations that are working in this space with different strengths, and how do we sort of bring it all together to really serve the population that's required. I think it's too early to worry about competition. There is still so much work to be done, and there's enough work for everybody right now. Right? It's just in some ways we at our end, for example, we are spending so much of our energy and effort in capacity building of professionals, training them, supervising them to deliver quality services because there is just so much need and demand. So for us, we can see that right now, the more number of people with high quality services who can develop and deliver evidence-based programs, the better it is for the ecosystem. So we're not seeing this as competition at this stage, essentially.
Good to have you on board, Dr. Malik. Thanks for joining in.